If you live and work in Nigeria, then it's very important to have the right health insurance. Pacific Prime is the world's largest distributor of international private medical insurance to individuals and families and SMEs around the world. In fact, in 2013, we were awarded the Top Global Distributor Award from Bupa International and IHI Denmark. We don't just work with these two insurers. In fact, we are the top global distributor, or the largest global distributor, for most international health insurance companies. And if we're not top, we're probably 1, 2, 3. So if you're looking for health insurance, why not talk to us? What we would do in the normal process is we would spend some time at the beginning talking to you to understand your needs. We would also start to try and help you understand the health insurance plan. Health insurance plans today are broken down into modules, and understanding the specific policy wording for each of those is critical. The modules we would normally think about are the inpatient component, the outpatient component, optical, dental, well-being, maternity if you're interested in starting a family. Then you've got evacuation and repatriation. This is going to be really important if you're living and working in Nigeria. Why? Because in the event of a serious medical issue, then it's most likely you're going to want to be evacuated or repatriated to perhaps South Africa or Dubai or back to Europe. After that, we also think about things like chronic conditions, coverage for pre-existing medical conditions, which many insurers can do today. We think about things like deductibles and excesses, geographical zones of coverage. We talk about lifetime renewability. Do you have the guaranteed right to renew the policy at the end of your policy year? So as you can start to see, understanding health insurance is very important, not just for you, but for us, because once you understood the plan, you can identify what's important to you, and then we can start the process of reviewing different health insurance companies and which one is going to be right for you. We work with all of the leading international health insurers, so Bupa and Aetna, Cigna, Allianz, DKV, AXA Triple P. The list is very long. But we'll also consider insurers you've perhaps not heard of, companies like William Russell or Integra, IMG, Medicare. The list is also quite long. So after we've completed that review, we would then come back to you and we would spend some time with you looking at the specific insurers and specific plans that we've selected that we think most closely match your needs. And I'm fairly confident that once we've been through that process of reviewing, maybe once or twice to go back and look at different options, but once we've been through that review process for several cycles, we can find the right insurer and the right plan for you. So my advice is, if you're living and working in Nigeria and you're looking for the right health insurance for you and your family, then come and talk to us. If you spend 5 minutes at the start of the process when you're looking for health insurance talking to us, I'm very confident you're more likely to buy the right plan for you and your family.
True story, I was flying down to Tennessee to speak to the Chamber of Commerce about coverage, and I was sitting next to a very nice man, and he turned to me, he says, "Well, what brings you to Tennessee?" And I said, "I'm giving a speech on the future of health insurance." "What brings you to Tennessee?" And he says, "I'm giving a speech on the future of liquid crystal display technology." And I was about to say, "That's nice," and he looks at me, I am not making this up, he looks at me and he says, "Well, mine may be nerdier, but it's going to be a lot less depressing than yours."
She is a contributing editor, contributing writer, or columnist for a number of prestigious healthcare periodicals. 3 times Modern Healthcare readers have named her as one of the 100 most powerful people in healthcare, and in 2005, the editors of Modern Healthcare named her one of the top 25 women in healthcare.
There are a lot of things wrong with our healthcare system, but there are also a lot of things right with our healthcare system, and I don't like it being referred to in the same terms that we use for juvenile delinquents. The other problem is that I worry that there is momentum to reform things that don't need reforming. I'm reminded of Tim Allen's great line from Home Improvement when he said, "If it ain't broke, you can probably still fix it." Okay, so the question is, if we've been trying to do this for so long, why can't we get it done? For some funny reason, we haven't been able to make workable policy. I just can't imagine why. But there are other issues. The first thing is policy making. You know, we tend to sort of think of the ancient Athenians in their robes having civil discussions about how to improve society. Policy making in this country is not a neutral pursuit. It is politics to its core, and it is often politics at its worst. This is just not an issue on which any politician is going to ride to glory. Policymakers generally view this as a third rail sort of operation, whereby no matter what you do, half of your constituency is going to get really angry at you. And understand there was a whole lot of deal making on the part of the Democratic leadership in Congress and the administration, especially the latter. And there are a lot of political promises out there that are going to have to be kept. I'll tell you truly, if you've got a health policy question, you can submit exactly the same question, exactly the same amount of money to the Urban Institute on the left and to the Heritage Foundation on the right. Exactly the same thing. All of the ground rules exactly the same. You will get two completely different studies coming to two completely different conclusions. The fact is, as long as healthcare costs continue to escalate the way they have done for decades now, no coverage program is sustainable because no one's going to be able to afford to pay for it over the long term. Furthermore, despite all the wails and accusations, there is no mandate in this statute for rationing of care, which frankly I find to be a pretty stupid argument anyway, given that care is already rationed in this country as it is in every other country. We deny access to most care to helpless poor people while rich guys can go shopping around the country for a new liver. The ethics equation is simple enough. Let's just put it on the table. If we do not believe that access to necessary care is a basic human right, then let's say so, establish it as policy, and move on to something else. But if, as most Americans say they do, if we do believe that it is such a right, then we have an obligation to do something to make it happen. There's a difference between coverage and access. Coverage says you've got theoretical insurance and some provider's supposed to take it. Access means that some provider actually will take you on as a patient. If you have coverage and nobody will take you, nobody will treat you, then your coverage is meaningless. I'm not polite. You may have figured that out by now. Campaign contributions make a tremendous difference. And you need money to run for office. And campaign contributions, I'm sorry, we're supposed to be a clean democracy, and you know, we're the oldest democracy on earth. We've done pretty well. Campaign contributions influence elected officials and their staffs and the people they appoint to write the regulations. It's one thing when a hospital closes in a town where other facilities offer the same services. It's another when hospitals that serve patients no one wants in neighborhoods where there is no alternative go down. Once you are a stockholder-held organization, your ethical responsibility is to the stockholders. So you can't really blame these guys for doing what the law and history and the board intends. The question is, should they be allowed? So my point and my position is, go back to nonprofit insurers. We are running out of primary care physicians. In 2007, less than 40